are you coming on down? Bring in the light, open up your arms and hey, are you coming along? Breathe in the love, open up your heart and hey, are you coming on down? Bring in the light, open up your arms. Hey, hey, are you coming along? Are you coming along? Are you coming along? Hey, hey, are you coming along? Are you coming along? Are you coming along? Hey, are you coming along? Are you coming along? Are you coming along? Hey, hey, are you coming along? 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 Hey, are you coming along? Step to the beat, dance to the drums. Hey, are you coming on down? Let loose your feet, soak up the summer. Hey, are you coming along?
Good afternoon, everyone, and thank you so much for joining us for the Crossroads inaugural webinar series. We're really excited to see all of you here this afternoon. Thank you so much for the Crossroads staff that have also joined us. And I think it's really important that I say thank you to Tandy Storie, who has agreed to be our very first presenter from Crossroads. So our focus on today's session is about, does my child have a learning difficulty? So that question obviously being answered from a number of perspectives. So whether you're joining us this afternoon as a professional who wants to maybe have an inkling of how a school such as Crossroads explore learning difficulties, whether you're joining us as a parent who wants to consider whether my child is meeting certain milestones, do I need to be concerned? Do I need to explore alternatives? Do I need to consider assessment? Or whether you're joining us this afternoon because you're interested, whether you're studying or whether it's a topic of interest to you. I hope all of you leave this afternoon feeling that you've gained a different insight and feeling as if it was an hour worthwhile spent. Just listening to the music, I think it was worthwhile joining this afternoon. So I think because we will be pitching the webinar to the middle, if there's any questions that you feel hasn't been answered or that you would like to explore further, Tandy will provide you with contact details towards the end. Also, we will have a range of resources that Tandy will share with you at the end of it. So I think without further ado, well, first of all, let me introduce myself. My name is Yolandi Roux. I'm the deputy principal, one of the deputy principals at Crossroads School. And I focus mostly on the academic aspect, as well as the senior phase and the learning support therapy team, and for my sins, quality assurance. So like I said, with no further ado, let me introduce you to Tandy Storie. So Tandy, I have to say, with a very impressive looking photo, and you'll see the real life in this case does actually live up to the photo. So Tandy is currently a member of the learning support therapy team with a focus on foundation phase. She's also a trained speech and language therapist, and she has worked as an educator at Crossroads in the foundation phase for a number of years. Tandy also this year formed part of the team that rolled out our Crossroads distance learning program for foundation phase, mostly on Seesaw. So as you can hear in that very long list in her bio, Tandy is an authority on a number of topics, including, does my child have a learning difficulty? So I think I'm gonna turn off my camera and put us over to Tandy. If you have any questions, please feel free to put it in the chat. Our session will be about 40 to 45 minutes, and then we'll have 15 minutes for questions. If you have any questions, just pop them in the chat box, and myself or Tessa will read them out to Tandy at the end. Please enjoy the session, and Tandy, there you go.
Thank you, Yolandi. I'd like to start off today in the mountains because really having a child with a learning difficulty is a long journey. And when you have a child with a learning difficulty, you walk a path with your child. And what I want to share with you today is information. I want you to leave today equipped to make good choices and to know where to find help when you need it. And so I want you to think about who you would like to join you on your journey, who you would like to perhaps leave at a path where there's a fork in the road. You may travel a long journey with somebody. You may have somebody who travels with you only a short time. You may want to find somebody who is really strong when you are needing to climb that cliff face that seems insurmountable. So today I want to walk you through a few things that you could put in your backpack, some tools, some guidance in terms of people you might want to walk the path with you at certain times. So today is really about sharing information and giving you the options that are out there. So moving on, what we're going to look out for today, we're going to talk about what to look out for and when to be concerned. When is a problem, and when is it just normal? And your child is taking a bit longer than everybody else. Then we're going to look into taking some action and what's required there. Then thirdly, we're going to look at the options in accessing help, where to find it within your budget. We're also going to look at a bit of what it's like to parent a child with a learning difficulty and what the process as a parent you are going through. And at times it's going to be difficult. So there, I want to talk about the resources that are available to parents. And then I also want to touch a little bit on the effect of COVID-19, because COVID-19 has changed the educational landscape, particularly in our setting where we've gone online a lot. There's been a lot more anxiety. So there's been quite a lot of change that's happened because of the way our world has changed over the last year. So that's where I'm going from now. So we're going to start off by looking at what to look out for. So when is normal variation okay? You're going to find that when a problem crops up, somebody, usually an old aunt, is going to say to you, they'll grow out of it, or they just need a little bit more time, or don't worry, Granddad spoke late, he spoke after 2 and look at how wonderfully he's done. The thing with normal variation is it is a very real thing. People are different. Everybody is different, and we develop at different rates. But when do we start worrying that somebody actually has a problem and that maybe it's not developing in a normal way? So we would look at the norms of development, which are readily available, and I'll give you some websites at the end where you can go and find those. And those, you want to look around those. So if the children around your child are starting to do things that your child isn't doing, and it's been a while and you're starting to worry, then you need to go with your gut and go with it. If a teacher has said to you, I think there's a problem, then that is a good indication that you need to perhaps look into the problem. Problems turn up at different times. So age is a very important factor to look at. Some children are identified early, and you know that your child may be at risk if they were perhaps born prematurely or spent some time in ICU or had repeated ear infections or have perhaps had early illnesses. So you know your child is at risk, and perhaps then you've already been identified as having a potential risk and you've already got a team in place. So there you would want to watch your child at all the levels, at the different milestones, to make sure your child is keeping up and to bring in the appropriate help where needed if your child is not keeping up with those milestones. A lot of children are then identified at preschool when they start really learning within a social environment. And the teacher then starts to notice where they're falling behind. So then you might start in a different place where somebody who was identified in a neonatal ICU might start with a doctor. Somebody in a preschool might be first referred to an occupational therapist or a speech therapist, or to an educational psychologist for a school readiness assessment. So where you start would depend on where the problem was first noticed. So in school-age children, often the starting point is the teacher. So I'm very glad to see that there are quite a few teachers on board today, because often that's the first point of contact. And teachers are very, very aware of what children need to be doing at each age. So if your teacher comes to you and says your child's not keeping up, it really is a reason to be concerned and to perhaps seek the advice of a professional. So I'll go through what those are in a few minutes. In terms of looking at your medical and family history, if perhaps you have repeated middle ear infections, your child might be at risk for developing a language problem. If your child was sick and in hospital and didn't move for months, they might be at risk for developing a physical difficulty. So if there's a medical issue that has come up, then you need to be cognizant that perhaps it will have long-term implications. The other thing to look for is a family history. So if you have a family history of attention deficit disorder or of epilepsy or of learning problems, you might want to have your feelers out a little earlier than someone where there's no family history at all. Although there's not a straight line to heredity, there often is a family history component. So that is a real reason to just have your feelers out earlier rather than later. Another one, particularly in the South African context, is anxiety. And particularly with the lockdown, anxiety has been heightened in many of our children. And if you think about it, if you are standing on the top of a building and you are terrified, you can think of your heart pounding, you can think of your shortness of breath. All you want to do is get out of that situation. And that is what our anxious children are living with. And they are feeling that in the learning context. And you could see that if you were sitting in that situation, you wouldn't expect to be learning your alphabet or learning any academic skills in that state. So anxiety is a really, really major problem in South Africa. And it's something that we need to be cognizant of at all times, because it does really shut down learning on many levels. So what we need to do is look at your child as a unique person, because no two children are the same and no two learning difficulties ever present exactly the same. Even in twins, they present differently because your child is their own person and they interact with their world in their own way. And your family system is unique. And the way your family interacts with the wider world and with each other is unique to your family. And your culture is exactly the same. You could be, living next door to somebody, but living completely differently. So I think we need to be aware that there's no one size fits all here. We look at each individual child and we start where they're at. So if you are identified by your teacher and perhaps they send you to an educational psychologist to see where the difficulties are, then that's where you start for your family. And if you're identified in a neonatal ICU because you've been in an incubator or you've been tube fed or whatever the case may be, you might start with a doctor. So you will start wherever you're at. There really is no one size fits all. What I do need to emphasize, though, is that even if you start early, obviously the earlier you start, the better. We always talk about early intervention. The earlier you get in, the smaller the gap is between where they are and where they should be. And so obviously it closes quicker. The thing is that sometimes you have to revisit, because particularly in the academic institutions we work in schools, the language demands and the physical demands and the perceptual demands change with time. So when you're in preschool, you learn your shapes and colors and you learn your sounds. And when you come to grade 1, that's formalized. And then you need to sit in a chair and you need to write formally. And it requires different skills to sit in a classroom all day from what it does to play on the playground and learn while you're playing. So often children who've been seen early need to be revisited in grade 1. And then again, when they get to grade 4, because the foundation phase years in grade 1, 2, and 3, we teach children to read and write and do mathematics. That's our aim. Our goal is to get fluent readers who understand what they're reading and are able to do basic mathematics. Then they go to grade 4 and that all changes. They now have to use their language to learn other things. And now we're learning history and geography, and the maths gets more difficult. And what we now assume is that they're fluent readers and that they have good comprehension. And what then happens is that we start to see that children may need intervention again. And then again, when they go to grade 7, the language demands of the curriculum change again, and they need to think more abstractly. So you might need to revisit again then, just to bridge the children over that gap, because the demands of the curriculum change. So sometimes they need a bit of a boost. So I think what's important to note is that early intervention is critical. The earlier you get in there and help your child, the quicker and the easier the process is. But it may need to be revisited, because we don't tend to keep children in therapy for life. When they are ready to be discharged, we discharge them. But they may need to come back at some point when we're at one of those critical ages, particularly, or whenever they need it. Okay. All right. So the next thing is taking action. Now, it's very important that we act swiftly and that we take action in a timeliest manner, because obviously the earlier we start to intervene, the better the outcome is. But it's important to take action with reputable sources. There are lots of fly-by-night companies out there promising the world. And my caution would be that if it sounds too good to be true, it probably is. Because of what I've said, because children are not the same. Each learning difficulty is unique to that child. The combination of difficulties is unique to that child. So there's no one size fits all when you're talking about a learning difficulty. You need to be looking at each child. So it's really a process of elimination to find exactly what your child needs, which is why I take you back to the path. We are walking a path, and there are going to be forks in the road, and there are going to be hills to climb, and there are going to be those days where you stand on the top of the hill and you think, wow, what a view. This is awesome. Aren't things going well? And then the storm clouds may gather again. So it is a process. But what your child needs in that process is a champion. So what we need in a parent is somebody who's going to advocate for their child, become a case manager, gather all the information. You're going to find the information that you don't like and may discard. And the point is that you have choice at every step of this process. You can choose the professionals you use. You can choose which advice to follow. You will make the best choice for your child where they're at in your family at this time. And you need to be confident in knowing that you will make that best choice. You're going to take the information that you're given and make an informed decision based on your child in your circumstances. Because your child is unique and nobody knows your child. No professional knows your child like you do. So take their advice. They have a working knowledge of all the ins and outs and the intricacies. But you need to be your child's advocate, and you need to be their case manager and their superhero, which is why we've put the superhero on here. Okay, so accessing help. There is lots of help available, and I'm going to go through today the medical help that you can have, the school-based help you can have, the public sector support, because much of what is available in the private sector is available in the public sector. And with COVID, there are so many families who are struggling financially that it makes much more sense to go through the public sector support. So there are options available, and I'm going to talk through some of those, and then the private practice-based support and the advantages and disadvantages of all of those. Okay, so let's start off with medical support. Okay, this is often where people start if they are diagnosed really early. So if your child is at school age, this is probably not where you're going to start. You might end up here, but you'd probably start with an educational psychologist. Whereas if your child is born premature, you're probably going to start with a medical person. So here we have pediatricians, we have neurologists. So if there's perhaps a family history of epilepsy, you might end up at a neurologist. There are developmental pediatricians, and often if we would refer there if there was a suspicion of autism, or if there was some kind of developmental delay, or if we were looking at a concentration problem. Then there are also psychiatrists who we look at for concentration problems, for anxiety problems, and yeah, so they form a pivotal part of our team, particularly in South Africa. Then we have ophthalmologists and ear, nose and throat surgeons. And this is vitally important because one of the primary things that can cause a learning difficulty is not being able to see. If you can't see, then your visual perception doesn't develop normally, and then it's very difficult to learn to read and write. If you can't hear, language is difficult to develop. So then you might have a hearing loss that causes a language delay, where it's a delay rather than a disorder. So we would first want to rule out that your child has no sensory problem, that they can see, so an eye test, and that they can hear. Because of course, if we fix those, then we can remove part of the barrier immediately. So the medical support is very, very important. But as I said, it may not be the first stop, because we're in a process of elimination. You're going to start wherever your journey is going to start from your circumstances. So when I look at school-based support, what a school that has school-based support would offer is a team approach. So you have your teacher, you would have an occupational therapist who would look at visual perception. She would look at sensory integration and modulation, which is how you make sense of the information that you are taking in through your eyes and ears and through your body and your senses, with your position in space. They would look also at how you make sense of that information at brain level. Can you pick the signal out of the noise on a visual level? And they also look at gross motor and fine motor development, which is critical for learning in a school situation. And then we would have a speech therapist on the team, and they, like the occupational therapist looks at the visual processing, the speech therapist looks at the processing of sound, of auditory processing. And the two then integrate when they develop well, and you need that integration to learn to read and write. So it's very important to develop both the visual perception and the auditory perception, particularly for reading and writing. Speech therapists also look at language, so they look at the content of language. What is your vocabulary like? Can you put a sentence together in terms of its form? Can you form a story? And also its use. So can you use language appropriately? Do you take turns in a conversation? Do you make eye contact appropriately? Do you know when it's appropriate to talk about certain subjects and not talk about others? Can you stay on a topic? So those are all things that the speech therapist would look at. Then in the school-based team, you'd also have the educational psychologist, and they're often involved in testing as well. And they would do a cognitive assessment. So that is the old-fashioned word for an IQ test. But it would also, that educational assessment often gives an indication of, they have a verbal and a non-verbal element to their testing. And they can pick out which of the other therapies would be indicated from that testing. So that the educational psychologist is a very good person to direct you in the right direction as to whether you need occupational therapy or speech therapy or physiotherapy or a combination. So the one person who's missing from this particular slide is the physiotherapist, who also works on the physical aspects of the child. Okay, then also in a school setting, you would have a learning support therapy team, and they tend to work on skills required for the academics. So skills required for reading and writing, and they are curriculum based, and so they support the teacher in the classroom. So the teacher would be teaching a lesson in a school-based setting, find that a child is really struggling, and the learning support therapist would then pick up on those difficulties and remediate there. So that is the role that she plays. So that's an academic role, and learning support therapists are usually teachers, whereas occupational therapists, speech therapists, and educational psychologists tend to be health professionals registered with the Health Professionals Council. And then the next person in the team is the teacher, who obviously runs the curriculum, and in a school-based program, the curriculum would run, I know where we are, we run the CAPS curriculum, which we adapt slightly to be skills-based, so that we are explicitly teaching skills to the children. But the teacher really is the head of this team. She coordinates the team around for each child. So at school, the teacher is the champion. So we would see the parent as the child's champion overall. So you would be really the pivotal person to fight your child's battles and to have their best interests at heart and to make sure those come to fruition. And the teacher forms that person in the school-based support team. And in a school-based support system, there is an individual education plan for each child. So the curriculum is taught across the board, but each child is on their own plan. And that plan is then an integration of what they need from occupational therapy, what they need from speech and language therapy, what the psychologist is thinking, because this, and what the learning support therapist is doing with them. This is a team approach. Everybody in this team around your child is working towards remediating the difficulties your child is having and getting them learning. And success for the team is a child that's learning to their potential. So in a remedial setting, our aim is to get the children back into mainstream as soon as we can ensure that they will be successful there. So our work is done when they actually leave us. But a school-based support team can be in a remedial setting, and I'm going to talk about the other school settings where this can take place as well. Okay. Now, all the elements of the school-based support team are available both in the public sector and in the private sector. So if you are looking to find a psychiatrist, there are really, really excellent psychiatrists working in the public sector. You might struggle it might be more of a process to get to them, but Tara does beautiful work. Charlotte McKeke has psychiatrists who see children, and so does Helen Joseph, so does Barrack Warnoth. So our public hospitals are set up to provide the service that is available in the private sector. The public sector also has speech therapists, they also have occupational therapists, they also have educational psychologists. Access is different from the private sector. Obviously, if you can afford to pay for the private sector, you have much more choice in terms of which practitioners you choose and the proximity to your house that they are and how often you're seen, where some of that is dictated in the public sector. But the resources are available and the resources are good. So the support is there. Access to the support can be a bit more challenging. And as I say, all the services that are available in a school setting are available in private practices. So you can then choose your speech therapist and choose your occupational therapist and choose your psychologist if you want to. The one difficulty is that in private practice, the team approach is much more difficult, and it doesn't work nearly as well as people who can sit around once a week and have a meeting about your child. So there are pros and cons of getting the support in a situation where all your professionals are acting independently. It's not impossible, it can be done, and some schools do that, and some parents opt to do that anyway, and it's absolutely your choice. You've got to choose the option that works for your family. So the message is that there are options out there. Okay, so now let's talk about the types of schooling. And when we start looking at the types of schooling that are out there, it becomes a bit of a minefield, because there are mainstream schools, which we know, and we've got those in both the public sector and the private sector. Then we have mainstream schools with support, where the school has a psychologist, the school has an occupational therapist, the school has a speech therapist, and they will take the children out during school hours or after school hours. They have remedial therapists. Lots of our private schools and many of our government schools have mainstream with support services. The curriculum in the classroom is the mainstream curriculum done at the mainstream pace, and the children are taken out to try and close the gaps where they are. This works for a child with mild difficulties, and it can work beautifully. And the right child in that situation will flourish. The question is it the right choice for your child? Because it might well be, but there are other options as well. So let me talk through the other options. You also get assisted learning, which is a mainstream curriculum, but a smaller class. And these tend to be separate schools. An example of assisted learning in our area is Newton House. They've got small classes, lots of highly specialized teachers, but they do a mainstream curriculum with help where it's required. Then you've got homeschooling and online schooling. They also do a mainstream curriculum, but you can choose your homeschool. So if you have a child who needs a school with only 3 or 4 learners, you can find one that has only 3 or 4 learners in the class. If you need one that does gymnastics, you can do those. There are a myriad of homeschools around, and they also vary. Obviously, you have to find one that worked for your family. Then if we have a look at bridging classes, our bridging classes have become very popular over the last 7 or 8 years. And they are classes within a mainstream school that are smaller. So they're usually about half the size of the class, of the normal classes. And they have a specialist teacher who does the mainstream curriculum, but allows for more time and assists the learners. And because the class size is smaller, those learners get more attention and they get individualized attention. And a lot of learners like this option because they get to stay with their friends at school. They don't move out. It keeps siblings on the same premises. And it works for a lot of children. There really is a place for a bridging class. But a bridging class doesn't work terribly well if your child has major difficulties, because the bridging class is still doing the mainstream curriculum. And if you have a learning disability, then often you need a skills-based curriculum, particularly in the early years. And the other thing with bridging classes is that they tend to end at grade 3 level. And then if you're not ready for a mainstream class, then often we find children coming across from the bridging classes to a remedial school, at which point they would then get the remedial intervention. So if your child is at risk for being a child who's going to require more than just a couple of years, then the bridging class is perhaps not the way to go. All right, then aid classes. Aid classes are attached to mainstream schools, and aid classes take more of a variety of children. So in an aid class, you could have children with differing disabilities. You could have children who are what we would term remedial, who just need a little bit of a boost and they'll be back in the mainstream. And you could also have severely affected children in the same class. So that is an option, and those classes are around, and they in our area, they are attached to our government schools. Okay, and then let me talk about remedial schools and learners with special educational needs schools. So remedial schools are available like Crossroads. Crossroads fits into this mold. We are a remedial school. Our aim is to return our children to the mainstream environment. So we take in smart learners who have potential, who have a difficulty learning, and we give them all the intervention we can. We get them confident in reading and writing and doing maths, and then the aim is to send them back when they're ready, and we are ensured of their success. So we don't put a time limit on this because no two children are the same, but the aim is to get the children back into the mainstream. A lot of our children who come in really early, they tend to get out earlier than those who come in grade 3 or grade 4, because it takes a little longer the older the child is for the remediation to take place. But as I say, we are not alone in this sector of education. There are remedial schools around us, both in the public and private sector. There are those with religious affiliations. So you can choose the school that works for you. So there's always choice. And learners with special educational needs is a term that some of the government schools in this sector use. So that's why I've included it here. So a school like Delta Park will call itself an LSEN school. It's a school for learners with special educational needs. And they, in the public sector, do very much the same work that we do in the private sector. Yeah, with some slight differences, but yeah, we are really servicing the same type of child. All right, so then we have special schools. So there are some children who are not cut out to be academics. And I always say there is a space for everybody in this world. We need to get our children there undamaged enough to enjoy being an adult. And they will find their place as an adult. And there are the special schools around tend to they still teach reading and writing and basic maths. They don't stop with academics completely, but they also teach motor mechanics or hairdressing or hotel keeping and catering. They do much more vocational training, so that the children come out of those schools able to do a job. And to find their place in the world. And that, if you are struggling academically, can often be an absolute godsend. So those schools exist. If you look at somewhere like Ruder Park, that's a public school that does that. Somewhere like Crest is a private school that does that. They are available. And we have a list of schools that I will email you, or we can email you tomorrow. We've got the government list that has all the government schools in the whole of South Africa, and I'll send you that link. And we also have a Crossroads list of schools where we have visited, know what they do, and we have a list of contact people there as well. So we can share that information with you. And if I can say, our principal has visited many, many schools. She won't recommend that our children are placed anywhere she hasn't visited. So she is a treasure trove of information if you're looking at schools. She really does know what's out there. And I'm sure she would be more than happy if you contacted her about that. Okay. And then you have special needs schools, which are schools for severely affected children. They are schools like Casa de Sol, and they tend to have a cradle to grave approach with the nursery school up to sheltered workshops for adults and old age homes. So they tend to be, there are many in the government sector that work very well, and there also are in the private sector if you fall into that category. Okay, and then there are also schools for physical handicaps or physical difficulties, hearing impairment, blind and low vision, and there's a particular school in Worcester that's particularly good at that. And there are also schools for multiple disabilities, like Hamlet. So there's a space for every child. And in South Africa, there is both a private sector space and the government sector space in all of these, except for the homeschooling. So there are options, and parents have choice. So you can look around and see something that's going to fit with your family and your child and their particular needs. All right, so things to consider when you're looking for a school. You want a holistic approach because your child is not only their academic potential. They are a whole lot more than that. So you want a school that is going to work for you and your family on an academic level, on an emotional level, on a social level, and on a physical level. Is there enough sport for your child? Is your child somebody who needs a lot of physical activity? Is your child someone who needs more social activity than a homeschool would provide? So you need to look at your child as a whole person rather than just the academics of schooling. You need to look at the type of academic support required, because you don't want to put your child in an academic environment that is not suited to where they are right now. If you aim your academic demands too high, there's going to be psychological damage caused. And if you aim them too low, they're going to be bored. So it's very important to get the right advice from professionals as to what type of support is required. You also need to look at the location of the school. Is it viable to travel long distances to go to school? Can you make it work? Because school requires more than just a drop-off and a pickup every day. In times before COVID, there were sporting events, there were extramurals, there were fundraising events like colour runs that you can see here in our picture, and movie nights and all sorts of other things. If you live too far from your school, that can become a problem if transport is an issue. You need to consider your child, your family, your culture, and your values. So if you don't want a school that is religiously affiliated, then don't choose that one if it's not going to work for you. You need to find something that's going to work for your family. And also look at the cost, because when you're looking at a school, particularly in the private sector, not all schools are the same. Some include therapy in the cost of their school fees and then allow you a tax break after that. Some have a school fee and charge for therapy privately, and then you can claim those from medical aid. Some offer their extracurricular activities included in the school program, and some charge extra for it afterwards. And this kind of schooling can become very expensive. So it's very important to look at what's included and what is not included in the fee. Okay, and then I want to talk a little bit about COVID. I'm actually just going to turn my light on here. The sun has gone down. Okay. All right. I just want to talk a little bit about what COVID has done, because COVID has changed the educational landscape in South Africa. And whether it's for the good or bad, we don't know the outcome yet because it's all still so new. But we educate very differently now. Technology is integrated into the classroom much more. Our children are spending much more time on the screens. We've found that when they've come back, they've lost some of the skills they had before. They lack stamina because they haven't been required to sit at school in a desk all day. So there are some things that COVID has actually added an extra overlay. I know that a friend of mine was saying her son was doing 17,000 steps at school every day before COVID, playing sport, walking up and down, changing classrooms, being physically active. And that went down to 3,000 steps when the lockdown happened. And just what that does to your physical development, particularly in the early years where your physical development is so important for your learning, when you're learning to sit in a chair and learning to keep your body upright and learning to write, we need to keep cognizant of these and perhaps mitigate for the lack of exercise that we're having. What COVID has also done is give huge financial stress and worries to families. So I think it's important that today we've looked at what is available out there, so that when you're in this process, and it can be a very daunting, very expensive process, that you do have options. There are places you can go, and we can point you in the right direction if you are struggling, that you can get it at a reduced cost. There are centres that you can go to for assessment where you can do everything in a kind of one-stop shop, where all the assessments would happen in a week, one professional per day. You can do it as a package and pay one fee. That's available. The Crossroads model is that we before you come to Crossroads, we require assessments, an educational psychology assessment, a speech language therapy assessment, and an occupational therapy assessment. But we don't require that we do them. And we do have people who would do them in their private capacity as part of the Crossroads basket, really. But those you could claim back from medical aid. So, yeah, and then once they came into Crossroads, all that therapy would be included. Okay, so really the last thing I want to talk about is the difficulties of being a parent with a child with a learning difficulty. There is a huge sense of loss. And I think one of our later talks is going to actually deal with what it's like to have a child diagnosed with some difficulty. You go through the stages of grief, and I think I'm going to leave this for our psychologists to touch on. But if you're interested, then sign in for that web chat, because it is a process, and it is a difficult process. And you are going to feel anger, and you are going to feel sad, and you are going to deny it and walk away at times. And I think the thing to remember is that this is a process. The professionals on the other side know it's a process, and we're there to walk this journey with you. We are quite aware how difficult it is, and there is support along the way. So finally, to wrap up, from a teacher's perspective, what is important for a parent to do is to be the advocate and the team champion for your child. We know you have your child's best interests at heart, and that you will make the right decision at the right time for your child in your circumstances. What we ask is that you take in the information, you make an informed decision using reputable sources, evidence-based practice, where people have read the latest research, where they know what your child needs, and where they are interacting with your circumstances to make sure that your child's needs are met. Also, that you're self-aware, because often we let our own problems and our own insecurities cloud our judgment with our children, and we all do it. But if you're aware that it's a process that does take place, then often we can pull back when that happens. We would like you to be available, to be part of the team, because without you, we don't really know where your child is at. You are a pivotal part of the team, and really you're the head of your child's team. So that availability to your child is imperative, and also to the people working with your child, because it makes the process so much easier. And then again, don't do it alone. There is no reason that you have to walk your path alone. There are support groups, and I recommend support groups. A lot of them on Facebook are fantastic. We have a support group at Crossroads for parents, which covers different topics. It's lovely to hear other people's journey, because often you can learn a lot and glean information that you can't glean from a professional, from other people who've actually walked your path. And there are many available resources that will help you not do it alone. And I will add those to our list of resources that we are going to send to you in our package that we're going to send after this talk is done. Okay, so I'm going to stop sharing right now. Oh, here are our contact details. If you would like to contact any of us or would like more information, you can also do info@crossroadsschool.co.za and it will find its way to the right person. We are always happy to answer questions, queries, put you in touch with the right people, and keep you informed of the latest developments that we are coming across. So yes, I'm going to stop sharing and I'm going to ask if there are any questions from the chat.
Thank you for that, Tandy. I think that was really insightful. Looking at the questions, however, both of them will require its own webinar, but let's start. And then if anyone in the team wants to add, please feel free. So question from Chantal. Hi, what is the main criteria to recommend bridging class versus remedial school? Especially after an EdPsych assessment, and it shows a child would benefit more from a smaller class, especially when parents fight the recommendation. So I think, Chantal, like I said, that's an answer and a half, but so Tandy, if you want to start off, and I'm happy to contribute as well.
Okay, it really depends on what the child's difficulties are. Because in a bridging class, children tend to be taken out for occupational therapy, for speech language therapy, for learning support therapy. They can get quite a lot of support. It depends on whether that child needs an adapted approach to education. So the difference between what we would offer at a remedial school and what would be offered in a bridging class is that the bridging class would carry on with the mainstream curriculum. Might be at a slower pace, there will be more individual attention from the teacher, there would still be the outside input from the therapists. At a remedial school, we would adopt a different approach to education. So the child would actually be taught differently. So when teaching reading and writing, we would teach the skills involved in reading and writing explicitly. So the difference in those two models is, does your child need the mainstream curriculum presented in a small group? So an anxious child, a child with mild problems, those kind of children do well in a bridging class. But a child with significant problems, a child who's actually not reading in grade 1 is going to be at very high risk then in a bridging class and would often then land in the remedial school in grade 4 when the bridging class is no longer there. So that is it's a very child specific question, because it's, what does that child's profile look like? And is there enough time in the bridging class to close the gap from where they should be to where they actually are now? Because a child who is struggling is not, so if a grade 1 child sits here and their peers are here, that's where they should be learning. So a child who's struggling is not learning at the same level, and then we send them up to grade 2 and they need to be learning at this level. This child has to close the gap that they had in grade 1 and then close the gap and learn what they need to learn in grade 2 to be on par with their peers. So the question is the bridging class going to do enough to bridge that gap for that child? And that you can only answer knowing what your child is what the profile is. And also the other thing is that you can change that choice. Nothing in this world is set in stone, and if you try and it's wrong, you can always change it. Yolandi, I don't know if you've got anything to add.
The only thing I want to add is the fact that it depends on who's asking the question. So if you're asking that question as a parent, you will be looking at the things that Tandy just discussed, as well as the provision available in your bridging class. If, however, as a professional, you are having a conversation with a parent, as a teacher or as a therapist, about what would be the most appropriate placement, that comes with relationship and the mountain pass that Tandy showed us at the beginning, that path that you've traveled with a parent. And not all of the parents are ready to make that decision. And often what a parent wants is to have an opportunity to try an alternative first. For as much as we've changed from a community or from a society perspective, some people really still struggle with the concept of a remedial school. Even though the educational psychologist and the school recommendation may be to go down the remedial school route rather than the bridging class route. So I think as a professional, you need to enable the parent as much as you can by doing the comparison that Tandy has just done, and possibly looking at the child in front of yours profile and compare that depending on the provisions to see which one on paper at least sounds like the best match for the child. So I'm saying that because Chantal, I don't know from what perspective you're asking the question. So just answering it from a professional perspective as well. Thank you, Tandy. So the next one is with regards to, does parental guilt, oh, there we go, as a teacher, I thought so. Thank you for that, Chantal. Yeah, I think it's very difficult. And I think as teachers, delivery is everything. If the first time a parent hears, so Tandy was talking about when parents for the first time hear that their child may be different, let alone have a learning difficulty. So it depends on who came before you, who spoke to the parent about what's different about their child, how they delivered that message, and what the child's long-term outcomes are. So often for parents, hearing that remedial school is an option, it sounds like the end of a road rather than the beginning of the road. So I do think as the teacher, you need to, so we have lots of resources available for teachers in mainstream schools to explore how to have that conversation. So if you would like to contact myself or Tandy, we'll both be happy to see if we can provide you with any support to mediate that conversation. So Tandy, the next question is, does parental guilt have a place in the cycle of the last slide? So obviously the last slide was question and answer. I don't think that's the one it's referring to.
No, I'm sure you were talking about my stages of grief slide.
Yes.
And yes, absolutely. It is a very, very real part of this process. And I think it's a talk in itself. And we've planned one with one of our psychologists about what it's like to be a parent who's just had this diagnosis and what that process is like. Because what we don't tell you when your child is diagnosed is that's not the first time, and it's not the last time you're going to feel those things. Every life milestone, those feelings can be brought up again. When other children go to school for the first time, if your child is not, all those feelings will come up again. When other children start to excel at sport and your child is not, it can all come up again. And even as adults, when you know, children perhaps go to university and your child doesn't, that could be another time that it comes up. Not to say that our children don't, I mean, remedial children go to university all the time. So that was a very bad example. But at every life stage, those feelings can come up, and guilt is huge, particularly if you struggled as a child. And to know that it's not your fault, and that there's lots of resources out there, and that there's a space for everybody in this world. So we deal with that guilt, and that guilt is very much part of the process, and it's very normal. And what really helps there is the support of other people who are also feeling the same. And that's why I say our support group at school is particularly wonderful, because it is a close-knit group of people now who are all going through the same thing. It's a real loss when your child is different. And it doesn't necessarily have to be a negative, but that guilt is a very real part of it. So yes, in short, the answer is yes.
Thank you for that, Tandy. If I can make a suggestion in particular, Arthur, is if we will invite you specifically to the session by our EdPsych team with regards to grief and how to deal with that process. So we'll definitely send you an invitation to that separately. So I'm just very aware that we are actually at the end of our webinar. I am going to do the other questions, but for those of you that do have other commitments, please feel free to go if you need to. Obviously, you're more than welcome to stay just for us to do the last question. So I'm going to take the last question, Tandy. It says, I see special schools for physical impairments. This is from Diana. Do any government school exists for children struggling to learn due to complex trauma and anxiety, similar to therapeutic schools found abroad?
Okay, I'm not familiar with the therapeutic schools found abroad, but we do have clinic schools that are available, and they often deal with complex trauma. And we do have a list of those resources, so I can forward those on to you. Yeah.
Okay, great.
So those do
Diana,
definitely
I
exist.
assume Tessa has your contact details, but if not, if you wouldn't mind just popping your email into the chat box, so then Tandy can forward those on to you. I think one of the difficulties that you often deal with regards to choosing the right school is that often children with physical difficulties or physical disabilities and learning difficulties are bunched together, although their needs are very different. So it's about finding a school that's specific to your child's need. Oh, there we go. Tessa says she has everyone's details. So thank you, Tessa. And then if Diana, we will just pass that on to you. So I think that's one of the difficulties about choosing the right school, which is to figure out whether there is actually a distinction or whether the school specializes in a particular area of support. So something like Delta Park supports a broad range of learning needs, which may not be specific enough to deal with, for example, trauma. But Tandy, if we can forward on the information to Diana, and then Diana, if you have any questions ensuing from that, if you can contact us, please. So I think with 3 minutes over, Tandy, that wasn't a bad job whatsoever. So I think just from everyone here, thank you so much for sharing your both personal and professional experience with us. And thank you so much for every delegate that chose to join us tonight. And I think the joy for us as a school is to have the opportunity that the webinar options have opened up, is to share some experience and some knowledge and skill to actually take that monopoly on information away. So if you have any suggestions about webinars that you would like to see, please feel free to contact Tessa as well. And then we'll take it from there. So I think I'm going to say good evening and have a lovely, oh, there we go. Have a lovely evening and thank you so much for joining us. I'll be ending our session in 30 seconds. Thank you so much.